My name's Gary McCarron. I'm with the Group Division out of San Antonio, Texas. And I'm here to explain to you why physicians are not accepting Medicare patients anymore. I've been in the health insurance business for 32 years. And this is the most interesting time that I have spent is the last decade. One of the reasons that the people are asking this specific question is that they do not understand exactly how the system works. So I'm going to explain that to you. We have what we call a physician's fees, and then the government has come up with relative value units. And all this started with the American Medical Association when they had standardized each one of the procedures that a hospital or a doctor does. And each procedure is given what they call a CPT code. And the CPT code is the acronym for Current Procedural Terminology. Now what the government has done is they have divided into 3 different areas what a doctor needs to be reimbursed to be able to survive in his physician's work. So we take a look at how much it cost him in mental and physical labor required to perform the procedure. And then when they go into the next category, the practice expense, supplies, heat, salaries, lights. Then the third most expensive thing is malpractice insurance, or because of malpractice claims. So we take a look at these things. We have work, practice expense, and malpractice risk. And this is one of the things that the government takes in consideration when they calculate these costs out. Well, one of the things that does affect everything too is what we would call inflation. Most of you are pretty aware of what inflation is. One of the areas that we take a look at, what I've done is I pulled from the history of inflation and looked at every year that we've had more than 10%. And you could go all the way back to 1970, it was 17, it was pretty far back. The area that we can see, or I'm familiar with, is in the 70s, 11%, 11.3%, in the late 70s, 1980, 13.5%, and then 10.3%. These areas right here, I remember them vividly. These were the Carter years, and we would go down to the store and we would have price tag over price tag because inventory went up so quick. Kind of a scary time. Let's take a look at these resource-based relative value scale that Congress has come up with, with the relative value unit. Now this is a page that I've kind of copied out of the American Medical Association, and these codes right here, these numbers, this is what you call the CPT code. This is the number that you're going to see on your EOB, explanation of benefit, when you go in and have a procedure done. The relative value unit is what Congress has decided that each one of these procedures are worth. Each one of your relative value units for each procedure is a little bit different. And then what they'll do is they take this dollar amount that Congress meets every year, and they decide what the value of the relative value unit is going to be. And this is determined each year, and it changes also. Now let's take a look at what the reimbursement fee is for the physicians. Now these reimbursement fees are as if you have a health insurance plan through your employer or you buy an individual health plan. These are the reimbursement rates approximately that are given to the physicians. The higher end physicians will charge this amount. 50% of the physicians charge this amount right here. These are going to be the realistic areas monetarily that the physician should be reimbursed. Now let's take a look at where the relative value unit should be in relation to inflation that we had just looked at. So let's take a look at COLA, which is the cost of living adjustment that the government has. And we're using government figures right here. So if we take a look at the COLA, you can see how it's kind of an interesting chart right here. It started out at $31.92 and it had risen to $31.93. Then we move over here, let's go down 2 decades later, and we're looking at $52.28. Now that's just keeping up with COLA. That's where the relative value unit dollar amount that Congress gets together should be at its absolute minimum. So let's take a look at the actual inflation in medical costs. All right, now the cost of living adjustment for medical expenses has averaged about 7% over the last 2 decades. And the reason why it's gotten so expensive is because of the new technology and the procedures that save people's lives. We can look back to the 60s when people died of heart attacks, and then look at the 70s when they started having open heart surgery. In the 60s it was experimental, in the 70s It was pretty common. Now it's just something every day that extends people's lives. These procedures are expensive. They didn't exist before, and there's multitude of other additional technology procedures that have come to fruition that have increased this above what the COLA rate is. So we're looking at 7% on the average of 20%. So let's take a look at what the government's done, with their COLA. So here's the percentage of the COLA. Now let's take a look at the relative value unit of the COLA with inflation. All right, so we come to this figure right here. We're back to the 5228 as we've seen. And then when we take a look at the relative value unit where it should be and the average of 7% in the medical, the relative value unit should be right around $123.56 if they kept up with the inflation effects of the medical area. Here is the relative value unit by percentage as Congress gets together and meets, and as they have done this, you can see that some years they think that the doctor's costs have gone down. Especially what fascinates me is in 2011, did you know that we had an 8%, according to Congress, decrease in medical expenses? I don't really think that happened. These are the changes by the percentages of Congress. Now, I can't believe that Congress would get together and decide that the physicians need 8% less than what they did the year before. Now let's take a look at this in real dollars. Where is this value of the relative value unit? What has it done over the last 2 decades? Well, we can see it started with $31, now we're at $34.02. That's a whopping $3.02% increase over 20 years. Should be at $123.56, keeping up with inflation. So let's take a look at this chart again. All right, so the relative value unit, which is this figure right here, 1271, multiplied times the current rate, which is $34.23. Okay, so you get a figure of $432. That's the fee paid by Medicare. All right, now we take a look at the COLA. If we were just keeping up with COLA, this would still be $664.47, which is less than this, but more than that. The physician would probably be a little more aggressive about taking a Medicare patient if it had just kept up with the cost of living adjustment. But this is where it really should be. It should be around $123.56. Now, when you multiply that times your 12.71, you come out with a figure of $1,570.45. This is about where it should be, because what this does is it puts you in this area right here, which gives the physician incentive to see the Medicare patient. Now, one of the things that this is a single payer system that we should really be cognizant about too is this Affordable Care Act. Do you think they're going to reimburse these rates, or are they going to be looking at this right here? I think it's probably going to be this right here, and that's one of the reasons you see some of the hospitals getting ready for the Affordable Care Act, and they're backing off, they're laying people off. They can't afford to operate at this reimbursement procedure. I think what we need to do is, as older people, we need to take a look at this, and even you younger people, you need to take a look at this too. Might not be a bad idea to get on the phone to your congressman and say, hey, this is why the physicians choose not to see Medicare patients, because they're losing money. And under the Affordable Care Act, it might even manifest itself too. We don't know. Time will tell. But this is the reason that most doctors are not accepting Medicare patients, is because of the reimbursement rate. It's just too low. They lose money. Thank you.